In today's video, I'm going to talk about how to enhance the results of face fat grafting. Also, I'm going to cover ways to reduce side effects, minimize swelling during the surgery, and extend the longevity of the results. So don't go anywhere. Check out the intro and I'll be right back. Hello, this is Dr. Ann, president of a fat college. I think people often underestimate face fat grafting and go into it a bit too lightly. There are actually several different methods for this procedure and surgery, which are why the cost can vary. Today I'm going to share some tips on how to get the best results. If you want to look younger and think that certain areas of your face, like your forehead, cheeks, or chin, could use a bit more volume, then fat grafting can be really effective. If you're considering face fat grafting, what are your expectations? What do you think is the most important result when it comes to fat grafting? Is it natural? Long-lasting? Look more younger? Look more prettier? Are these things? Yes. And today, let's talk about how to make that happen. First, let's think about what happens as we age. Our face is made up of skin, fat, muscle, and bone. As we age, all these tissues start to lose some of their function or volume, which can lead to a bit of hollowness. When we do fat grafting, we're actually correcting that hollowness, filling in areas where volume has decreased. To get a natural result, we need to gently smooth out the curves of our face. That's how we create a soft, beautiful outcome. If one area is too exaggerated, it can lead to an unnatural result. A lot of people see those before and after photos in subway stations and say they don't want to end up looking like that because it looks like unnatural. I totally get it. Also, I'm not a fan of that look either. Many people even come in for face liposuction to correct those overly dramatic results. It's not ideal to just keep adding and removing fat like that. For a natural outcome, it's really important to add just the right amount of volume to the areas that need it without going overboard. You want it to last a long time, right? When people lose weight, what's the first place they notice it? Almost everyone says their face. After just a few days of dieting, coworkers can usually spot it right away and say, "Hey, you lost weight." But sometimes it seems like the face loses fat even when you haven't lost much weight overall, right? That's because the fat in the face tends to have better blood circulation than in other areas, so it usually lost much faster. And before we talk about how long it lasts, it's important to know that fat retains its characteristics no matter where it's moved. When fat is moved to the face, it doesn't take on the face's characteristics. It retains the properties of where it came from. So if you take fat from your thighs, that fat still has the qualities of thigh fat when you use it. It takes on the characteristics of that stubborn area that won't go away, no matter how much you diet. Yeah, the amount of fat in your face is really important for how long the results last. If there's not much fat on your face to begin with, it can really affect the outcome. For people who have little to no fat in their face, there's not much extra fat to lose. And as they age, there won't be much left to lose either. So you've got one group with very little fat in their face, and then there's another group that has more overall fat, but might be lacking a bit in areas like under the eyes or in the cheeks. When these two types of people get fat grafting, it shows different durations. The duration of results is actually pretty subjective, but generally speaking, a lot of people find that the results of fat grafting last quite a long time. On the other hand, those who already have some fat in their face often say that the fat tends to go away more quickly. For thinner people, most of the face fat after grafting comes from their thighs. So even if they diet or age, it tends to stick around and doesn't lose as easily. That's why I see some people who still have plump faces even 10 years later. On the other side, for those who had a lot of fat in their face, it can disappear pretty quickly as they age. So they might need to get another fat grafting in a couple of years. Some might wonder if they can just put in a lot of fat up front to avoid that, but that's exactly what leads to an unnatural look. If you overdo it thinking about how it'll fade later, it can end up looking really unnatural. There are actually a lot of different techniques for injecting fat. Each doctor has their own method, but the most important thing is to add it in very small amounts. Sometimes people come in to have fat removed because it has calcified. This usually happens when a large amount of fat is injected into one area all at once, which is a big technical issue. You need to add it little by little, almost like stacking very thin threads. That way you can prevent these side effects and also help the results last longer. Injecting little by little takes a lot of time and effort, which is why the cost of fat grafting can vary so much. When done carefully, not the process of taking out the fat, just the injection time alone takes over an hour. If someone rushes it, they might be done in about 10 minutes. The way fat is refined also makes a big difference. Some clinics just suck it out with a syringe and inject it right away, and they charge a few $100,000 for that. But that method can lead to quicker loss of fat and a much lower survival rate. Some people might say that after about 3 months, there are no traces left and that it didn't work for them, so I'm telling you, it's not true. Surgery is all about the care you put into it. A truly meticulous fat grafting surgery isn't something that can be done for just a few $100,000. To improve the survival rate and even enhance the skin, stem cells can be used, and that can really make you look much younger. A 70-year-old might end up looking like they're in their 50s after such a surgery. Etc. The method I mainly use for fat grafting is a lifting technique. In other words, I inject fat while also lifting the skin. One of the most common side effects of fat grafting that people see a couple of years later is sagging in the cheeks or eyebrows. This happens when the fat that was injected loses volume at the top and shifts down a bit, creating an awkward look. If you've had fat grafting before, you probably know what I'm talking about. That's why it's important to start injecting fat from the upper areas. By doing this gradually, you can achieve a lifting effect on the skin. Adding more fat in the right spots helps pull the skin upward, giving that lifted appearance. Depending on the situation, we might also use something like a cog thread to pull and secure everything, which can make the face look much younger. Sometimes we can even do face liposuction at the same time. Knowing where to add and where to take away fat is key to transforming the face into a slimmer, younger looking version. There are quite a few people who get for partial fat grafting, but I don't really recommend that method. The fat used in fat grafting contains adipose-derived stem cells as well. So after the fat grafting, you can really see the skin looking very radiant and having a great texture. But if you only graft fat to specific areas, that spot can end up looking radiant and lighter, while the rest of the face may look a bit uneven. For example, if you inject fat only in the cheeks but leave out the areas around the mouth and chin, you might see that the overall face looks lighter, but the mouth area stays dark, creating an unattractive contrast. That's why it's important to add a little bit of fat all over the face. The swelling can be influenced by various factors. A careful surgery usually doesn't lead to much bruising or severe swelling. Within about a week, you can put on some makeup and go out without any major issues. Sometimes you might need to work on the eyelids, especially for people with sunken eyes. Those people might get a bit of bruising, but it's usually not too bad in other areas. It's doctor did about being careful and adding just a little bit at a time. If you inject too quickly while shaking your hands, it can cause a lot of damage to the blood vessels, which increases the chances of bruising significantly. So, the speed of the injection is really important. After surgery, using machines like swelling injections, low temperature radiofrequency, ultrasound, or low frequency devices can really help reduce swelling after fat grafting. Generally, some commonly used devices can actually kill fat cells. That's why choosing the right equipment and technique is super important. You definitely shouldn't use these methods just for anti-aging care. Today I talked about fat grafting, and when done with real care, it can lead to beautiful results. I recommend finding a meticulous doctor for the surgery. One more thing to mention is that while adding fat to the face is important, where and how you extract it is also crucial. So it's really important to get your fat grafting done by a skilled doctor. Did you enjoy today's contents? If so, please subscribe, like, and turn on notifications. I'll keep sharing great content in the future. Thanks for watching,